Everyone. Today we are going to discuss about national mental health policies. All the policies, programs related to mental health are there to support the mentally people as well as to provide education to mental illness as well as mental well-being. National Mental Health Policy describes some values and strategies to reduce the burden of mental health problems and stigma. The National Mental Health Policy is formulated to prevent mental illness and promote mental health. So, it is formulated to prevent mental illness and also to promote mental health. This is the definition by WHO, World Health Organization. According to World Health Organization, National Mental Health Policy is an official statement by the government or health authority that provides the overall direction for mental health by defining a vision, principle and values. So, it has a vision, it has a principle as well as some values. In 2011, Government of India constituted National Mental Health Policy. After some discussions and recommendation, the policy has been considered by the Ministry of Health and Family Welfare. After some corrections again in the guidelines, in the year 2011 itself, the National Mental Health Policy has been formulated. The policy acknowledged the importance of useful and relevant local knowledge and practice, and the policy addressed the mental health issue in a comprehensive manner. The 65th World Assembly took place in 2013, approved the resolution on problems of mental health disorders and need for comprehensive care. And India was the main sponsor of this resolution. The National Mental Health Policy implemented with adequate support in 10th 5-year plan. Just keep that point in your mind, guys. The National Mental Health Policy implemented with adequate support in 10th 5-year plan. Now we will see the goals in 10th 5-year plans, 11th 5-year plans and 12th 5-year plan. In the 10th 5-year plan, that means from 2002 to 2007, extend district mental health program attached to 100 medical colleges in the first phase and again hundreds in the next phase. So 100 medical college attached with district mental health program, again after that 100 more mental health program attached to again another 100 medical college. So 200 hospital medical colleges with district mental health program. That was the goal of this 10th 5-year plan. Then 50 lakh fund to each medical college. Then 11th 5-year plan, that means from 2007 to 2012, again the extension to another 200 districts and quality improvement and start research. Then 12th 5-year plan from 2012 to 2017, extended DMHP to other 193 districts. So 100, then 200, then 193 districts. Special issues focused more on senior citizens and Alzheimer's problems, child sexual abuse victim care, poverty, homeless women and wandering people. So this national mental health policy given more importance to this below listed group: senior citizens, Alzheimer's, child sexual abuse victims, poverty. I mean those who are facing poverty or those who are under poverty level, homeless people, especially women and wandering people. What are all the goals of this National Mental Health Program? Before going to see the goals, we will see the vision. The vision of the National Mental Health Policy is to promote mental health, prevent mental illness and enable recovery from mental illness. That's the main 3 points. You have to keep it in your mind while seeing or while thinking about the vision of National Mental Health Policy. Promote mental health, prevent mental illness and enable the recovery from mental illness. Apart from that, promote destigmatization, because there is a stigma and discrimination present in the field of mental health, and ensure socio-economic support along with provide accessible, affordable and quality healthcare and social care to all the person through their lifespan within the right-based framework. That means without harming their rights. Next is goals: to reduce distress, disability associated with mental health problems, to enhance understanding of mental health in the country, to strengthen the leadership in the mental health sector at the national, state and district level. Distress reduction, enhance understanding and strengthen the mental health sector. Then while coming to the objectives, there are a lot of objectives: to provide universal access to mental health care. That's the first and foremost thing. accessibility of mental health care to everyone. Increase the access and utilization of comprehensive mental health services. Increase the access to mental health care to everyone, especially the homeless, illiterate, socially deprived people, wandering people, elderly people. So the word access is very important and we can see everywhere. Easy access of mental health care to everyone. Then to reduce the prevalence and impact of risk factors associated with mental health problem. There are a lot of risk factors which create mental health problems. So find out that risk factors and reduce the risk factors prevalence. Reduce the risk and incidence of suicide. To ensure respects for rights and protection from harm of person with mental health problem. Reduce the stigma associated with mental health problem. Enhance the availability of skilled human resources. Enhance financial allocation, that's very important. And to identify, address the social, biological and psychological determinants of mental health problems. Next is values. The values include equity, justice, integrated care, evidence-based care, quality care, participation of mental health workers and clients' family in care, effective delivery of care, holistic approach. Then issues focusing in national mental health policies are stigma, population, poverty, homelessness, person in orphanages with mental illness, elderly caregivers, person affected with disasters and emergency problems. Stigma. There is a stigma present in the mental health fields. To find out the stigma and solve the stigma. Violation of rights. Mental ill people's rights are easily violating. So, the National Mental Health Policy is giving more importance to protect the rights of mentally ill people. Vulnerable people. That means gender alia who is in jail, rescue home, children's in juvenile home. Give more importance to that group of people and elderly caregiver support. Then internally disorganized people, that means shifting from rural to urban, urban to rural, that kind of problems those who are facing means that people. Then person affected with any kinds of natural calamities, disasters, etc. Then another managerial populations like marginalized populations like sex workers, victims of human trafficking, victims of rights and sexual minorities. Other important components are provision of adequate funding, include family participation, intersectoral collaboration, institutional care and research. The work pattern, how it is working means effective governance, prevention of mental illness, promotion of mental health, community participation, easy accessibility of care, training and research. This is about National Mental Health Policy. Hope you understand. Thank you.